So thank you very much for joining us. CAMFT is thrilled to provide this free Lunch and Learn workshop for everyone and to support our members. Thank you to our sponsors, Geico, CPH, and Simple Practice for co-sponsoring this Lunch and Learn series. We really appreciate them, and they're longtime sponsors of CAMFT, so thank you very much. While this is not a CE event, remember to visit the CAMFT on-demand library for a variety of recorded clinical and legal and ethical workshops to earn your CEs. You can find that at camft.org/self-study, www.camft.org/self-study. We'll be posting stuff in the chat, messages for you, but the chat feature is disabled right now. Use the Q&A to type in your questions and to upvote, hitting the thumbs up button to indicate questions you like. As a reminder, last year, CAMFT staff attorneys answered 18,000 legal, ethical, and licensure questions. If you're a member, you can call and have your questions answered by our team during regular business hours. So let's post the first poll, and let me introduce Barbara Griswold. But let me read the questions here first. So during doing online sessions, which interrupts your concentration most frequently? Alerts that you have an email or a text and you can't resist multitasking, your pet who barks, meows, wants to join you or wants to check out your keyboard, your kids who are noisy, knock on the door, want to join you or want to check out your keyboard. So put in your vote now. While I'm waiting, thank you, Barbara Griswold. Barbara is a CAMFT member, former member of the board of directors, and has given hundreds of workshops on billing and insurance. So would you like to say anything else about yourself, Barbara?
I've been a CAMFT member for, I think, 35 years. So
you started at 5?
Huh?
You started at age 5?
Yeah, something like that. Yeah. So I'm just delighted to be here and to talk about this topic, which some people think is not very interesting, but I weirdly think it's interesting.
It's important. You know,
getting paid is important. I like getting paid.
Exactly. So the results are 61% said email or text alerts. Not surprised about that. 23% said their pets. And then 16% said their kids who were noisy at entering the room. I wonder if that reflects that our members may have a somewhat older experience. And so their kids are not young enough to be knocking in and crawling in, kind of stuff. Anyway, thank you. So just a reminder for everyone, post your questions in the Q&A. So we're going to start with a general question. So what exactly is telehealth, and what are some of the biggest changes in telehealth coverage due to COVID-19?
Well, first I wanted to ask, are people seeing me on the screen? I'm only seeing me in a little tiny, or is everyone seeing me?
We're seeing you.
Okay, good. So what is telehealth? I just want to clarify. Some people are asking me, is telehealth, what's the difference between telehealth and telemedicine? Same thing. Basically, telemedicine's kind of an older term because it came about when doctors were using telehealth before we were. Telehealth is just a little bit more inclusive. So it's one that I use more in terms of behavioral health. And so what are some of the biggest changes that have happened since COVID? Huge. A lot of plans before were not mandated to cover it. Only like, I think 36 states are mandated to cover telehealth. And even then, like California is one that is pretty progressive. Insurance plans would be like, okay, well, we'll cover it, but only in certain situations, like, you know, when you wear green, no, but no, when the provider is in network, or when you have you're on our provider telehealth list, and when you've attested that you know the laws in the state and you've signed something with us, or maybe only when you can prove that there's no available in-person provider, and then we'll allow you to do telehealth. Maybe we won't cover psychotherapy, but we'll only cover other types of services. Maybe we'll only cover it when doctors provide it, but not when you lowly therapists provide it. Phone sessions typically were not covered. So there was a whole bunch of things like that were hoops, so that some plans, I don't want to say it like every plan, some plans were really open to it and were covering it standardly, but a lot of plans were not covering it standardly. Then COVID comes along and there's a huge push. Pretty much all the insurance plans say, no, we want you to be doing telehealth sessions with your clients. And, I think a lot of this has to do with they don't want to, well, I shouldn't guess, but it's certainly more expensive for them if people are coming in person to see you and then they all get sick.
There is a reason why they're doing it. It is less money to pay for telehealth than to pay for an ICU bed.
Yeah, I think so.
Even though we don't know why it is. But
right, we can't. But in any case, there's a probably one of the most uniform thing that happens between insurance plans is they all pretty much agree, yeah, we need to cover telehealth. It's not the same between each insurance plan, so that's one of the myths out there. One of the reasons I wanted to do this workshop or webinar is that there's some myths out there about telehealth coverage that is leading to people not being reimbursed or not billing correctly. And so I really want to make sure you guys are doing it correctly.
Okay, so we care about that as well. We want you to be paid and be paid as well as you can, right?
Yes.
So what are the CPT codes that should be used for telehealth? And well, let's do the easy question.
Yes. So this is a really frequent question I get because people are like, well, they're looking through this thick CPT code book trying to find, and there are some for phone sessions. There aren't any specifically for video sessions. So they're either using the phone session ones, which we shouldn't be using. Those are for doctors. They start with a 99. They're not meant for therapy codes. Don't use those. Basically, this is a really simple answer. You use the same codes that you would use if you were in person with that. Now, when I say the same codes, I'm saying the same CPT codes. Now, what's the CPT code, just for refresher for people? Those are those 90834, 90837 codes that tell the plan whether you did an individual session for 45 minutes or you did a couple session or you did a group session. So it's those 5 numbers that start with a 9 that tell them what kind of session it was. So you're gonna use the same codes you use in person. Again, just in the CPT codes. We're going to talk about what's different in the other codes.
Okay, so I'm going to take one of the questions we wrote and combine it with one of the most popular questions from the Q&A. So if I'm using the same CPT code on the claim statement, how does the health plan know that it was a telehealth session? And does every insurance have different codes to indicate that it's a telehealth session?
Right.
Carol Voll's question.
So the myth, there's some myths out there that, well, let's back up. There's two main ways an insurance plan will know that it's a telehealth session. You need to change 2 places. Place of service code we'll come back to, and modifier we'll come back to. So place of service code is basically where you tell them where did it take place? And we usually use a code 11. For those of you who are in network, you put a little 11 for each date of service. For those of you who are out of network, you probably don't even use this code. So you're like, well, I've never used that code. So, well, they just assume it's office if you put nothing. So for your little receipt you've been giving your out of network clients, they just assume it's office. But no more. You have to, and I encourage people who have a super bill, which I hate that word. No one likes a super bill, right? So on their statement, have a new category for place of service code. So it jumps out because you're going to have to write a different place of service code for telehealth for almost every insurance plan. And I'll tell you some of the exceptions. And the new place of service code for telehealth is 02. And so whenever you're doing a telehealth session, that will alert the insurance plan, oh, 02 says that this is a telehealth. Now, is that for phone? Is that for, video or both? Typically, it's used for both. I'm going to tell you, I don't know if I'll tell you now, but I'll tell you where to find out which ones they want. I'll say more about that. So typically, you're going to go from that 11 to the 02. Except for a couple plans will still want you to keep using the 11, which is interesting, like Regents. If you work with them, Medicare wants the 11. Blue Cross Blue Shield of Louisiana, even all the other Blue Cross Blue Shields, and some of us do out-of-state Blue Cross. MHN wants it for phone sessions. That's one of the ways they're differentiating.
Okay.
And one San Francisco plan even wants a 98 place of service code. So the key point I want to make here is that you have to find out from the plan what the codes are that they want. And I'm going to tell you how to figure that out.
Good. Give us a tip. Give us a tip.
The second, though, thing I want to talk about is modifiers.
Okay.
You can't just put a different place of service code and think that that's going to be it.
Okay.
Some people are contacting me, and I knew this. They're telling me they told me I need to put a modifier, but they wouldn't tell me which one. So, well, yeah, they don't want to suggest a modifier, to you. Sometimes they say you have to put 95 or GT, and you're like, well, what's the difference? And which one do you want? So the bottom line is you can get your claims denied if you don't have a modifier. So what's a modifier? It's a 2-digit code that follows the CPT code and again says to them, this was a telehealth session. And there's 2 main ones out there. It's a myth that 95 is the new code and that you should just add this to all your CPT codes and that's fine. No. There's a couple plans out there that still use an older code, which is GT. And some of them are insisting that that's the one that they will accept. They're not accepting 95. I'd say a lot of plans are accepting 95 and GT. Either one you want to use is fine. Some of them are like, no, we want 95. Some of them are using GQ, which for phone sessions or something else. So again, we come back to don't make assumptions. My number 1 key rule for any of you who have ever seen me speak is never assume anything with an insurance plan. Just contact them. Now you're going to tell me, I've tried to contact them. I can't get through to a human being. I can't find out. So what I did is I put several weeks of research into it, and I have put together a list of all the health plans that I could find their telehealth instructions to, their billing codes, their coverage information for telehealth, and I put it all together online and I update it regularly. And so it's constantly changing. And you can find that, and we're going to post it, I think, at the link at theinsurancemaze.com/telehealth policies. Pretty easy. theinsurancemaze.com/telehealth policies.
It just got posted. It was posted a few minutes ago while you were talking, so good.
If you click on that, you can scroll down to MHN, you can scroll down to Aetna, you can scroll down to Blue Cross Blue Shield, you can scroll down to whatever plan you're working with, and it'll give you the link to what's their latest policy, in terms of coding, in terms of coverage, in terms of copayments, stuff like that. So obviously the best place to get information is going to be that calling and getting that client's particular coverage, because it could vary, but this is next best.
I want to remind folks that we're focusing today on questions regarding billing and telehealth. So any questions about general telehealth, I'm going to refer you to the workshop that Kristen Roscoe did with me, the very first one, and another one that we did with Ben Caldwell of Simple Practice. So as a reminder, go to those ones as well for more information. We'll post those links. Yolanda Iturralde asked, are we recording this to send out the link? And we will send out the link. So yes, we will send out the link. It'll be in our post email. And go to the CAMFT YouTube page for now.
I want to say one more thing. Oh, okay, good.
Go ahead.
I wanted to say one more thing about modifiers. I had a note to myself. If you're working with Optum or TRICARE, those are 2 of the ones that are hanging out with GT. So be careful about using the new 95 modifier with that one.
Optum and TRICARE. Okay, so then Leslie asks, how can we know who is waiving copays and when they will stop waiving them?
Yeah, good question. So that you go to my to my page, and we cover that. But you're going to have to go plan by plan. But most plans are waiving copayments, I would say. Most of the plans that I looked into are waiving copayments. What does that mean? The client comes, not comes for the session, but they have the session and it's free to them during the pandemic period, usually starting about March 15th or so. So ones before that aren't going to have their copayments waived, but you'll possibly see that the ones after that have them waived. What does that mean? You get paid less? No, it means that if your contracted rate with the health plan is $80 and the client usually pays $20 and the health plan usually pays $60, instead you're going to be getting checks for the full $80 without the copayment taken out. So you're not going to get paid less. But the cool news is that the client doesn't have to pay. Now, the scary thing is that not all your clients, even from the same plan, are going to have that situation. Always need to call, you always need to contact them. It may be a fairly safe bet if you go online, but I have 2 Anthem clients. One of them is getting their copayments taken out and one is not. So I don't know if that's an error. I don't know if that's because he has an out-of-state Anthem plan. So, you know, it's one of these situations. Also, one therapist told me that she received some corrected claims. So sometimes you may have had some already processed with the copayment taken out and then got some corrected claims with it, you know, adjusted basically, so you get more money. But for some of us who've already collected the copayments, we are going to have to be refunding our clients. We do owe them that money. We can't just be like, oh, we're going to keep the difference. No, we have to, you know, refund them. And it is annoying, but at least you got paid and you're not out money.
Can you wait to refund until you get the payment from the insurance company?
It's a really good question. I have to say I am taking checks from people, or I'm not running their credit cards, but I am definitely, what I recommend everybody is that you take a credit card on file for people, and so that, and you tell them about the situation, and that if their copayments are not waived, that you will run their credit card. I am now with telehealth making sure my little butt is covered financially and that I have a credit card for everybody on file.
Okay, so I'm going to ask a question that's been getting a lot of upvotes, but it's very specific. So when I bill 90837-95, the Simple Practice billing portal says it cannot go through. When I take the 95 off, it goes through. I don't accept insurance, but I want my super bill to be helpful, effective for clients' reimbursement. So what do I do?
Yeah, that sounds like a Simple Practice problem, but there should be a way in Simple Practice to add a modifier, and it may not be adding it onto the CPT code. It may be that there's a separate place to enter modifier.
For that one, as a reminder, Simple Practice is a CAMFT affinity partner. Go to Simple Practice's website. And if you aren't using Simple Practice, through CAMFT, you can get 2 months of free using Simple Practice. So feel free, we'll post the link up here. Okay, let's go to our out-of-network session. Oh, here's a question, one more poll. Would you rather give up your smartphone or give up your computer, laptop? That is super easy for me. I know the answer to that one. So just a quick question, but while we're waiting for the poll, are out-of-network providers being covered?
I would say in general, it's hard. I would say you can pretty much count on it if you're in network that you're going to be covered. Out of network is much iffier. That's probably the one that I'm not seeing universally covered. People are, they're pointing to the fact that we cover, don't worry, we cover telehealth, and then very small type practically for our in-network providers. Now, my sense is with some of them, if you're working out of network and you're already working with somebody pre-pandemic, that they are open to continuing to cover your telehealth, but you may have to call them and kind of make a special arrangement on that. In terms of new clients, I think they're wanting to funnel them through the in-network for a lot of these. So again, this is one of those situations where you need to go to that link I gave you check the particular coverage information for that insurance plan. Some of them are being much more generous than others in terms of out-of-network providers. Yeah, I didn't answer the one prior where she asked how long is the copay is going to be waived, and that's a big up in the air question. I think it's going to depend on each insurance plan and the shelter, how long the shelter in place order lasts.
Okay, so let's go to, let's hear the results. The results are 66% would give up their computer, 34% would rather give up their smartphone. I am the computer, totally with you on that. If they had said iPad, that would have been much harder, iPad versus phone. But computer versus phone, I'll give up my notebook. I haven't turned it on in months at home, my personal computer. Okay, how do I resubmit a claim if I didn't put the right codes, particularly those early March, those mid-March sessions?
Right. Yeah, this is actually a little conundrum, because what if you did your usual, you put your place of office code at 11 and you didn't put a modifier, and so it was processed like a normal out of network, I mean, like a in-person session, and it was actually telehealth, and the copayment was taken out, and your client paid something that they shouldn't have paid, and it kind of gets messy. Yeah, so I looked into this, and on the CMS 1500 form, for those of you who use that form, which would be most all you in-network folks, there's a box 19, and you want to, we never use this box, and you describe what you want, like I'm resubmitting because I used wrong place of service code, make that shorter, but, and then in box 22, you're gonna put a 7, which says that you're resubmitting a claim, and then the original claim number. And that will alert them, and then put the right information down below. So it'll tell them you're reprocessing this claim.
Okay, great, thank you. Okay, so Carol Windsor's asking, if the payers end allowing telehealth, do they have to notify us?
I would guess we will not be notified. Like, they're not gonna come to your door and tell you. They're not good at that. I think you have to stay really up on tuning into their announcements, go to their websites, because they are updating. You know, a lot of the information I'm getting that I give to you on my website is just, I've Googled Aetna COVID telehealth coverage. You know, it doesn't take much for you guys to do the same thing. I hate to put myself out of business, but some of what I get paid for is just that I searched the internet and I get the information that you can get. And if you do it every week or so, you're going to get the latest information too. So
I mean, inevitably, there will be a point where insurance companies stop coverage and you haven't heard for a brief period of time. But if you are watching your email, so that's waiting for them to announce, but I'm with you, Barbara. I wouldn't count on a generous announcement. Insurance companies want to make as much money as they can, so they're gonna do it and then tell you afterwards.
Well, do make sure, I don't like to think that they have an evil intent.
No,
but I do say that make sure that you are getting regular emails. You should have gotten regular emails from all of the insurance.
Yeah, you should have received.
If you're not, I would be contacting them and saying, do you have my email? Am I on your email list for announcements? Because a lot of us
Or you might have canceled the subscribe, like yourself. You might have canceled the subscribe. Go check. Did you get the email announcing the waiver and the allowing of telehealth? And then checking the website specifically. You could also go through the insurancemaze.com, but it's a good practice to every week check and make sure that this is still going on. Okay. Then the next question we got, let's see, we've got how many minutes? 6 more minutes. We're going to go a little bit beyond 12:30, but we're going to keep answering questions. Insurance companies have said they won't reimburse for telehealth beginning July 1. Maybe some insurance companies have said that. However, I work in LA County where the stay-at-home order is still in effect given our county's high rate of infection. My clients and I don't feel comfortable returning to in-person sessions yet. What options do we have?
Well, I mean, that's kind of a personal clinical situation for you. You guys have to figure out if their insurance, it's the same way if they lost their insurance because they lost their job. I mean, you have to figure out, am I going to do free sessions with this client? Am I going to do a reduced rate with that client? But it sounds like they're saying.
Well, but the other thing is, it's July 1 is still 6 weeks away, 5 weeks away. We've got some time. And as we know, things can change like that. It was pretty amazing how fast insurance companies said they would cover telehealth. And the slowest was Medicare.
But she has a good point. There's like, I have several clients who are immunosuppressed, and they're not coming back when the shelter order,
That's true. That's
and I don't think they're going to come back all year, or maybe until there's a, whatever vaccination. So I think we have a case-by-case basis in terms of what our insurance plans. I think insurance plans are going to continue to provide telehealth at a higher rate. I don't know if it's at, the rate that they're doing now, but I think we're going to see much more telehealth coverage from now on, because first of all, it makes sense in so many ways.
I mean, the Pandora's box has been opened, and I don't see us going back to 99.99% in person. Like, certainly not immediately. So
the issue that may come up is that they historically have not supported home offices. Yet some of us are not going to want to have, hundreds of dollars for rent for an office that we're not.
Right.
So they're going to probably have to switch that policy too, in terms of allowing a home office that is telehealth only. So there's going to have to be lots of changes, and it'll be interesting to see what changes.
This is where your calls to CAMFT are really valuable, because we do get a pulse on what's going on in the industry, and we can use that information to advocate on a system-wide issue. Not you as a member, but if we see that 25 calls from Optum are not getting callers to CAMFT, they're Optum providers and not getting reimbursed for telehealth, that makes it easy for us to write a letter to Optum saying, what's going on? We need telehealth covered, for the huge mental health needs that Optum patients have. And so we can advocate a little bit on that part.
I want to also just talk quickly about documentation before we end.
Oh, well, yes. Let's talk about documentation.
I get a lot of questions about that. Like, how is my documentation different, or needs to be different for telehealth sessions? And for the most part, no, it's like the same types of things you're going to be recording: symptoms, severity, what are your interventions, But the first thing that you should have in every progress note is, was it a video session? Was it a phone session? Was it in person? So don't forget to log what kind of session was it, so that we have that. That could be important. Also, we're supposed to do this, which is we're supposed to verify where the client is at the time of the session. Right. You don't know if all of a sudden they melt down and say, I'm going to kill myself, whether they're at a Starbucks, whether they're in their garage, whether they're at their grandma's house, whether they sheltered in place to their mom's house in Modesto. So each session—
out of state.
Or out of state, and you're not supposed to be, you have to get special permission to do that if you're doing it. So basically, you, at the beginning of each session, are supposed to ask them not only where are you, not like I'm at my mom's house in Modesto, but what's the address? And you're supposed to have that in case you need to call for help for them. And number two, you should at least verified address, of client or something like that. You don't have to write it down each time if you already have it on file, but verified address. So those are two of the big things. Obviously, a telehealth consent is really, really important. It's not mandated right now or by the state, but I totally think it's so helpful in going over important things with clients in terms of things to think about, how to make it more confidential on there, and what are some ways that they should be introducing me to their mother and the dog shouldn't be there. We just how can they put a sign out? There's lots of things in my telehealth consent that has things for them to think about that is going to make sure it's a better connection, and things on my end that I am going to be doing. So telehealth consent, and also that credit card authorization. Those are some documentation things to think about.
It is 12:30, so I want to let people who need to get off at 12:30 to get off, to leave the webinar. But we're going to continue answering questions for at least another 10 minutes. So we're going to get through some more of these Q&A. But Barbara, would you like to say anything before some people start to leave?
I just want to say that, you know, there's so many questions out there, and I'm happy for you to just email me at theinsurancemaze.com/contact. And you can just send me your questions. And if it's like 5-minute question, I'll just answer it. And if you want to set up a consultation, we can do that. But I have all kinds of resources on my website, webinars and books and stuff. So check it out. Okay.
So a number of people have been asking if the changes in laws or regulations are allowing me as a licensed therapist in California to do telehealth in other states. So I know it's slightly different from billing.
That's okay.
I
have that down to 3 answers that I've gotten from attorneys. So you can all check me. Well, Kristen's not on now. But the basic thing is, you know, usually you're definitely able to practice if you are licensed in the state wherever your client's feet are. That's how I look at it. You know? Right. If your client is physically located in a state and you are licensed in that state, you're golden. If your client is in a state where you are not licensed, the basic tenet is that you can only do it if you have permission from that state licensing board. Now, have things relaxed? Yes, they've relaxed. However, there's a state-by-state list of the relaxations during COVID. And if you guys don't have it, people can contact me and I'll give you the link. But there's a great one that has kind of there's 2, which is one is what is the usual, and then there's one is the COVID relaxations. So this is great resources that I have. But anyway, yes, they've relaxed, but I think it's always important to be on the safe side and you know, don't do it without getting special dispensation from the licensing board in that state.
I believe that information is also on the CAMFT COVID resource page. We have a link to AMFTRB that lists all the regulatory bodies for every jurisdiction in the US.
And also, this is not exactly related to billing, but this is a huge question, which is the HIPAA question. Do I have to use a HIPAA, you know, compliant platform? I get it so often that I just want to throw it out there. Right now, the HIPAA, the federal government is looking the other way. They are not enforcing HIPAA standards. So you can use a non-HIPAA compliant platform for your telehealth, but the laws didn't change. They just are looking the other way. So we recommend that you use, or I recommend that you use a HIPAA compliant platform, obviously always, and it's good to set that up now for later, but right now you could use something like Skype or you know, FaceTime.
I think Zoom is in the non-HIPAA compliant.
Yeah, well, Zoom has different layers. They've got the Zoom Basic, which isn't usually HIPAA compliant, and then there's Zoom for Healthcare, which is. So yeah.
Okay. And then Joseph asks, as an out-of-network provider, private pay only, I don't communicate with insurance plans. What is the best way to list the telehealth modifier on my monthly statements to clients who seek reimbursement? Is it 90834-95/95? No space 95.
Yeah, you know, that's a good question. If I had to go with one of those, I would do -95. You could even write out modifier 95 if you wanted to. I'd probably do -95. And if you have to write out place of service code 02, I mean, the most important thing is just make it super clear. I also, on my out of network statement would say, 45 in the description section, hopefully you have one of those, it would say 45-minute psychotherapy via video, you know, or telehealth.
Via phone.
In my description, I would get one more time, tell them that it was telehealth, because basically I don't want them ever coming back saying, oh, we didn't realize that it was a telehealth session and we paid it wrong. You just want to be like, I was super clear with you guys.
A little redundancy goes a long way in reducing headaches.
Absolutely.
Absolutely. Okay, any advice on telehealth platforms and payment platforms for clients' copay?
Yeah.
They say Doxy isn't working well for me.
I use Doxy. I love it, and it had to do with working on my internet was the problem. But I don't. Yeah, we don't want to get into the technological piece. There's other people who can do that better than me. Definitely better than me. I did have another thought. Payment parity is another question I get a lot of questions about in terms of, are we going to get paid the same for telehealth? And we definitely should. There's been a lot of legislation around that said that you should be getting paid the same for your telehealth sessions as you are for in-person sessions. Department of Managed Health Network came out, Managed Healthcare came out in March and kind of mandated that all health plans that were operating in California needed to do that. So if you're not getting that, complain to CAMFT.
Okay.
Yeah, complain to CAMFT.
Okay, Gabrielle Roberts asks, what types of actions are pursued with legislators to improve reimbursement for telehealth providers? So I'll answer that question because that's in my wheelhouse.
All right.
So we can't directly address reimbursement rates, but we can address the can we be reimbursed? And I think clearly there's going to be legislation on telehealth when this eases up, because we now know we can do it. And there's going to be a lot of push to do it, I think, from patients. So we're going to be working on looking at helping with regulatory bodies, BBS, as well as with the state. And there may even be some federal stuff, but we don't tend to focus on the federal stuff outside of Medicare. But we're probably going to encourage more equitable access to telehealth. So I see that coming substantially in the future. Okay, so what if I have not accepted insurance until now? How can I accept insurance? I don't think has anything changed?
Well, actually, some plans are onboarding new people faster. But
wow, that's a miracle.
Yeah, I know. But a lot of them are just as slow. You could still take 6 months. If you right now contacted them and said, I want to, I'm interested in joining your plan, it still could take 6 months to join. That's pretty standard, but it depends on the plan. It depends on whether they're accepting new people. It depends on whether they need new people in your area. It depends on lots of things and what kind of specialties you have. So yeah, it's same as always in that, you still have to get out there and try to, chalk yourself up to the plans. But a lot of them are kind of full, are not taking new providers in some areas.
Okay, so someone asked, Maribel Flores asked, do you have to be licensed to be paid through insurance? Are associates able to be paid?
Usually not, but I think in certain cases they can, like in certain practices where the supervisor or the group has kind of worked out an agreement with the plan to cover the associates, or the associates have some kind of special, if the associate speaks a particular language that is needed, or I know one person who spoke sign language and they really needed that. So I think as a general rule, associates are not covered. In terms of telehealth, I've seen a couple plans that said something specifically about it, but you'd have to contact them.
Okay, so here's a question. Do insurance companies agencies require additional certifications, trainings to provide telehealth?
No.
During normal non-COVID?
It kind of frightens me, frankly, because I think, normally before all this hit, one of my little soapboxes was that I thought if you're going to do telehealth, you should get a lot of training. There's a lot of little nuances. There's ways that we should all be trained for the legal and ethical. What should we have in our treatment consents? There's just a lot of things like I want people to thoughtfully move into telehealth. Well, that all went out the window. We all, some of us unthoughtfully had to go into telehealth very quickly without training. And even before that, the plans who were covering telehealth were not for the most part, never asked for training. I didn't see anyone who said, you need to complete a training before we'll have you on here. But I did see one that said, I attest that I know the laws of California.
Right, the attestations.
Well, you didn't have to prove it. You just have to sign you knew it.
That's the same like you have to attest that you've done all your CEs.
Yeah.
for BBS, and we know that 30% of people who renew their licenses have not done their hours.
If I ask my 13-year-old, please attest you did your homework, you know. Come on.
Okay. We are out of time, and I want to be respectful of everyone's time, especially Barbara's time. So I want to thank everyone for participating. We are going to have, we're going to send a webinar, a 2-question survey in a new browser, and it will give you an opportunity for a drawing for a free 2-hour CE webinar from our online learning library, which is a value of up to $40. So I want to thank Barbara again, Barbara Griswold. Thank all of our attendees. We have 2 more Lunch and Learns on May 28th with Katie Vernoy, Therapist Self-Care during the COVID-19 pandemic, and on May 29th with Kurt Woodholm, Telehealth with Kids. I'm really excited about that one. As MFTs, your time is critical, so we want to thank you for sharing your time with us. I'm sorry we weren't able to get to everyone's question. This video, if you have more questions, call the CAMFT line. We're open from 1 to 2 today. We're closing early for the holiday weekend.
Or contact me.
We'll see you again on Tuesday. Or you can go to our website, camft.org/resources for members during COVID-19. It's also in the bar at the top of the CAMFT homepage. And thanks again to Geico, CPH, and Simple Practice for co-sponsoring this Lunch and Learn series. Everyone be safe, be healthy, be well. Enjoy your holiday weekend. Thanks, everyone. Take it easy. Bye-bye.